When you see that this is a time that your community or your country needs you, and if you think you have what it takes to contribute, then don't hesitate. You got to jump in and do it, because people's lives are on the line.
Hi, I'm Dometi Pongo, and welcome to The Essentials. As we've remained alone together at home to flatten the curve of COVID-19, we wanted to tell the stories of the young people who haven't had that option. The doctors, nurses, and service workers who have put their lives at risk to save more. Today we'll meet Abraar Karan, a doctor and medical fellow in Boston, as he reflects on what got us here and how his and our nation's work has only begun. Tell me about your journey into medicine and epidemics.
I'd go back to India a lot as a kid, almost like every summer, and was really struck by the sort of separation between the haves and have-nots. I remember distinctly as a kid, people coming to the door with deformities, fingers cut off, things like that, knocking at the window, hoping for some spare change. I realized that there was this immense level of disparity, health disparity and human rights disparities.
What's remarkable about your journey, it sounds like a lot of it is influenced and empowered by this understanding of inequities, coupled with this understanding of medicine and how fixing those disparities could improve quality of life for so many people.
That's right. That's absolutely right. I think that health is central to everything we do. You can't work if you're not healthy. You can't take care of your family. You can't fight for your rights if you don't have the right to health first. Epidemics expose these fault lines that already existed. They expose our vulnerabilities as communities. They expose the social inequities that we have and the health inequities that we have. It wasn't surprising to a lot of us in medicine that we were seeing our Black patients suffering so much more from this epidemic, having higher case rates, having higher death rates, having disproportionate access to testing, having disproportionate access to ventilators. All of these things were already in place and set up from the way that society has treated our most vulnerable for centuries. I think that's been something that has been difficult to know that was going to happen, and to see it actually play out and happen and see people die.
And it's unfortunate that even though you read the tea leaves, that you saw this coming, you still watched it all play out in real time. What was your initial reaction when you first heard about COVID, and how do you think the response has been?
It was a holy shit type of moment, because it was understanding that if we didn't stay weeks ahead of this, we were going to quickly become weeks or months behind in what we needed to do. And we may have had to do something really drastic, like just shut the entire country down. I think that's been one of the challenging things, is we've never dealt with something like this before in the United States, or really in the world. I mean, this is unprecedented for the time that most of us have been alive. In other countries, there's actually a lot more institutional experience with managing epidemics and managing infectious diseases, which are actually so much more common. And yet, when COVID-19 struck, the focus and spotlight turned to what is the US going to do, what is the UK going to do, what are European countries going to do, rather than what are Asian countries doing, what can we learn from them? They've managed viral epidemic outbreaks in the past. And then now, as things move into sub-Saharan Africa, why are we not turning to them for their expertise and their ground level understanding of public health response measures that they use to overcome Ebola? And I hope that actually it prepares us better, because epidemics are not going away. We are entering, or probably have already entered, an age where emerging infectious diseases have a high risk of spreading quickly through globalization, and that, COVID is here. Who knows what the next epidemic is going to be, and how are we going to respond to that?
How does it feel to be called a hero in times like this? I imagine that's a lot of pressure to carry.
It is. And I don't personally know any doctors who want to be called the hero. This is no different than what we've always been doing. A lot of people will tell you, as soon as COVID hit, there was not a second thought in our mind that we needed to be there for at the bedside as needed. I don't think anybody wants to let the idea of heroism take away from the fact that we're human beings, that we need PPE, we need protection at the front line, we need to make sure we don't burn out, we need to make sure our mental health is protected.
I also saw a tweet where you talked about how so much heroic work goes unrecognized.
Earlier on, I was helping out with the sort of state response here. There's a lady that came every night to clean the workspaces that we were working in. She's from El Salvador, and she's at the front line. She's cleaning the workspaces, right? She's exposing herself to potentially fomites in the middle of a pandemic. But she's not raised as a hero. She's not on Twitter tweeting things, or she's not doing an interview here with MTV or any of that stuff. So who's recognizing her? Who's putting her at the forefront? And these are the same people that, when we're not in the middle of an epidemic, are people who are discriminated against by immigration policies or stereotyped against. And these are the people that carried society. These are the people that made the hospital run. There's no other way to look at this. And I really hope that when the epidemic does pass in the future, that we don't just go back to the old status quo where we kind of like forget these people and marginalize them and don't even treat them as equals.
Right. And you mentioned earlier about how important it is to protect your mental health. How have you been doing that personally?
I mean, when you wake up every day knowing that there is no option but to push on and push forward, then you don't really have to make a choice. The choice is one that you already made from the start. There's not been yet since February 26th, which is the day that I started sort of more in an official capacity working on COVID here. There has not been a day that I woke up where I didn't feel motivated to keep pushing forward.
I love that, man. I know there are days that are tougher than others. Has anything helped you get through some of those really bad days?
There's always times where we feel tired or we feel like the weight is heavier, the burden is heavier than usual. And I think there were some late nights I stayed up watching The Last Dance, Michael Jordan documentary, and hearing about the way that, basketball's, greatest player pushed forward through everything to sort of define his legacy. And the quote that sticks out to me is, why would I worry about missing a shot that I haven't yet taken? And I think every day with the code response, every day that we wake up is a shot for us to do this better, to get this right, to save someone's life, to treat our patients, to treat our most vulnerable communities, to take a stance against racism. Every day is a shot to do that.